75 must-know medical terms. Abrasion, a cut or scrape that typically isn't serious. Abscess, a tender, fluid-filled pocket that forms in tissue. Acute signifies a condition that begins abruptly and is sometimes severe, but the duration is short. Benign, not cancerous. Biopsy, a small sample of tissue that's taken for testing. Chronic signifies a recurring, persistent condition like heart disease. Contusion, a bruise. Defibrillator, a medical device that uses electroshocks to restore normal heartbeat. Edema, swelling caused by fluid accumulation. Embolism, an arterial blockage, often caused by a blood clot. Epidermis, the outer layer of the skin. Fracture, broken bone or cartilage. Gland, an organ or tissue that produces and secretes fluids that serve a specific function. Hypertension, and high blood pressure, classified as primary and secondary hypertension. Inpatient, a patient who requires hospitalization. Intravenous, indicates medication or fluid that's delivered by vein. Malignant, indicates the presence of cancer cells. Outpatient, a patient who receives care without being admitted to a hospital. Prognosis, the predicated outcome of disease progression and treatment. Relapse, return of disease or symptoms after a patient has recovered. Sutures, stitches, which are used to join tissues together as they heal. Transplant, the removal of an organ or tissue from one body that is implanted into another. Vaccine, a substance that stimulates antibody production to provide immunity against disease. Zoonotic disease, a disease that is transmissible from animals to humans. Tachycardia, increased heart rate, usually more than 100 beats per minute. Amniotic fluid, the watery liquid surrounding and protecting the growing fetus in the uterus. Anaphylaxis, anaphylaxis is a severe and potentially life-threatening allergic reaction that needs immediate treatment. Antenatal, before birth. Antibiotics, medicines to fight an infection caused by bacteria. Antibody, blood protein that helps fight attacks on the immune system, such as those caused by bacteria and viruses. Bacteria, tiny organisms that may cause certain infections. Bicornuate uterus wound, a heart-shaped uterus, usually the uterus would be pear-shaped. Ca1-5, a protein in the blood that is raised in ovarian cancer. It can also be raised in endometriosis, pregnancy and infection. Colostrum, the first breast milk produced during pregnancy and in the first few days after baby is born. Complete miscarriage, when all the tissue associated with the pregnancy has gone and the uterus is empty. Counselor, a trained professional who helps people to make sense of feelings and issues. Immunity, the body's ability to resist infection and disease. Deep vein thrombosis (DVT), a blood clot that forms in a deep vein. Diabetes, a condition caused by high levels of glucose, a form of sugar in the blood. Diagnosis: the way a medical professional assesses a condition or disease. Dysmenorrhea: painful periods. Ectopic pregnancy: when a fertilized embryo implants outside the womb. Anticonvulsants: drugs used to treat seizures. Chemotherapy: the use of chemicals to treat disease, often used to destroy cancer cells. Choleretic: an agent that promotes bile production. Heel spur: an abnormal growth of bone or calcium on the heel bone. Hematoma: blood that leaks out of blood vessels and collects in the body. Hemiplegia: paralysis on one side of the body. Hyperglycemia: an abnormally high amount of sugar in the blood. C-section: caesarean section, where a baby is delivered through an abdominal and uterine incision. Labs: laboratory work or tests. Hypoxia: lack of oxygen in the body. Audiology: science of hearing, balance, and associated disorders. Tumor: a swelling or mass, often used in relation to cancer. Laparotomy: any surgery involving an incision in the abdominal wall. Venipuncture: the drawing of blood from a vein. Allergic: having a sensitivity to one or more normally harmless substances. Alopecia: loss of hair. Amnesia: unusual memory loss or forgetfulness. Amputation: the surgical removal of a limb or their body part. Analgesia: absence of pain. Angiogenesis: the formation of new blood vessels. Asymptomatic: showing no signs or symptoms of disease, whether or not disease is present. Laceration: a tear in the skin. Ligature: any material that is tied around a blood vessel to stop it from bleeding. Lipoma: a known cancerous tumor or growth composed of fat cells. Malaise: a general feeling of illness that can be a sign of disease. Malnutrition: failure to eat or to properly absorb the nutrients needed for good health. Melanin: a substance that gives the skin, hair, and eyes their natural color. Menopause: the point marking the end of menstruation. Neuralgia: a burning or stabbing pain that follows the path of a nerve. Neuron: a nerve cell. Orbit: the bony socket that holds the eyeball. Ossification: the process by which bone is formed. Osteoblasts: cells that build bone tissue. Thanks for watching.